Welcome to selfdiscoverywisdom.com, formerly known as Self-Discovery Media. On these podcasts, you're going to hear people who speak from the heart. They've taken the journey in life. Many things have happened to them, but they've changed it to happening for them. And in their strength, their courage, they've discovered their abilities and their wisdom, and they are now sharing it here with you. Do enjoy each show. We bring it to you with love and knowing that it's going to help you on your journey of life. Good morning, good afternoon, and good evening, everybody. Welcome back to another edition of Your Health is Your Choice, right here on selfdiscoverywisdom.com. I'm your host, Sarah Troy, and my guest is Zaman, Shah. What are we going to be talking about today? Well, something very, very intriguing. AI. You know how I like AI and all that it can do for us, but we're going to be talking about AI in medicine. His Midway is an AI healthcare platform that eases burdens, reigniting clinical passion and restoring human connection in medicine. How does that work? Well, this is what we're going to be talking about today. He says, as a physician and a healthcare leader with nearly 15 years of experience, he's witnessed firsthand how overwhelming administrative burdens and fragmented patient data systems have deeply overwhelmed the clinical well-being and the patient care. Driven by these personal and professional experiences, he founded Midway, an AI-driven healthcare platform designed to eliminate these burdens, and restore clinical passions and foster genuine human connection in medicine, as it should be. His mission is to share this transformative vision because he firmly believes that healthcare must become simpler, smarter, and more compassionate. By automating time-consuming tasks and enhancing access to clinical patient information, we empower clinicians to reconnect with the fundamental purpose, which is caring deeply for patients. Sharing this journey and vision benefits not only the healthcare professional by restoring their work-life balance, but also profoundly improves the patient experience, ultimately fostering a more empathetic, efficient, and human-centered healthcare system. I think this is so desperately needed. So, boy, a very good time because I'm in Canada and we have a doctor shortage. In fact, at the present moment, we're fishing for them from America. Come on over. Which many of them go, yes, I'm coming. There's two factors that they always have in it. Is one, the paperwork takes too long. Right, so they can't get to see the patients. That means that seeing the patients, the time is cut down. Instead of being able to really listen to the patient and pay attention to what the patient needs. And of course, with us here, generally the rents are too high for physicians to have premises and all of that. But number one thing their argument is I don't have the time to see the patient because I'm too busy doing the paperwork. And your side of the business is helping having AI eliminate all of that so they can spend more time with the patient and find out what really is wrong and not having to make a guess because they've only got 5 minutes before the next patient and 10 minutes doing all the paperwork. So welcome to the show. Love, a great topic for us to talk about today.
Well, thank you so much, Sarah. It's a pleasure to be here. You're absolutely right. I think this is something I have noted firsthand, over the nearly 15 years of, being a physician here. And it seems like these demands on physician times in terms of compliance and legal and insurance payments and each one of these things is taking the focus and the time away and really kind of degenerating that connection, that human connection that is desperately needed. Just to kind of quote a statistic, I was looking at one study that basically was, kind of inferring that really about 27% of a patient of a physician's time is actually spent in direct patient care in a given day, 27%. So roughly a fourth of their time.
Yeah.
Everything else goes to, what you talked about. And, talking about Canada specifically, I actually had the opportunity. I was kind of on an elective rotation during my medical school, and I worked at Toronto Western Hospital. And I was really shocked at some of the things. Like I would see, some patients with the faculty members there. This was a neurosurgery rotation, and they would give them for people who have brain tumors who I thought needed something done in a couple of weeks. They had to
Yes.
wait like a year
Hmm.
to actually have the procedure scheduled and have something done. So
Yes.
this is really the time where we need to talk more about restoring that human connection in healthcare, where we need to talk about efficiency. And that's why AI is so important in the middle of all of this.
I interviewed AI a few weeks back. I had a conversation with AI and had AI talk about what it is, how secure is it? What is it capable of doing? And it said that when it came to the medical side of things, where you use it as a assessing what a problem is, I mean, basically, kind of AI has been used in medical apparatuses for quite a while, but there are more and more machines coming out with AI based that are able to kind of assess what's wrong with the patient very, very quickly, which then gives the doctor more knowledge on how to treat the patient instead of what seems to have happened so much is I'll treat this ear, but not that ear. It's just little sections of you instead of the whole of you because of the time constraint or this, that, etc. So we need AI to help us. And it's a totally different AI to your chat GBT or any of those AIs. It's been completely programmed along the medical system to actually understand and assess. So this I see is a way of the future. And I know that many doctors are saying, please bring it on. We need this help. We need not only the help on the administrative side, giving us more time for the patient, but we need more assessment through the AI mechanical. I don't know, what do you call them? Machines? I'm not sure. What do you refer to them as? But there is a machine over in the UK that goes in and you answer a few questions and it assess everything. And then you see the doctor who has now the complete, inside out of you. And now it
Mhm.
knows what to do with it. Over there, it costs about 350. Over in the States, it's 10,000. Right. So I think a lot of what we have to do is also take kind of pharmacare out of running medicine, accountants out of
Yeah, yeah,
running medicine,
definitely.
and get back to humans running medicine using these devices.
Yeah, absolutely. I think that is the most important aspect of this. And I think if there's one thing I can emphasize from this podcast, that would be it. That really we need to think about AI as a companion, as a
Mm,
level of support, as an enabler for physicians, rather
yes,
than as a replacement for them. So
exactly.
yeah, so when we think about being as a patient, for example, a lot of people have this concern, or maybe even as physicians, people can have concern like if AI comes in, how is it going to, potentially thinking about maybe distorting the connection between patient and physician, but it's actually to the contrary. So
Yes.
basically, the way AI works is it does kind of the repetitive, mundane, time-consuming tasks for you while as a physician, it empowers you to be there for the patient, in their most vulnerable moments, to listen to them, to kind of really, bring that human connection back,
Mm.
into the practice of medicine, which is obviously needed for sure.
I mean, back in my day, I mean, I'm 70, so when we used to go to the doctor, it would be a 20-minute, half an hour. And it would be, oh, it hurts, but where does it hurt? And then they would ask all the questions. What's going on in your life? What's your diet like? What's this? What's that? And kind of realize what's hurting is not really where the problem is. The problem is over here. And I feel now there is no time for a doctor to actually, kind of assess where the root of the cause is. And it becomes the band-aid with
Mm.
pharmaceuticals or the band-aids, let's chop it off, instead of going to the root cause. And I feel a lot of doctors are actually leaving the profession because they feel they're actually not treating a patient anymore.
Absolutely. And that's one of the things, like you mentioned in the introduction as well, that's one of the areas of focus because really, when I signed up for this profession, it was not really to sit in front of the computer like, 2/3 of my time and typing and working on documents. It was basically to interact with patients,
Mhm.
to help them out and to heal and to make clinical decisions and management and so forth. But of course, that thing, has evolved into what we see now. And this is really important that we bring that balance back for physicians, that we
Yes.
bring sort of that quality of life and work-life balance back for them, where they are in the best shape to be the best version of themselves in delivering care to their patients. At the same time, as a human being, they also have a more balanced life and everything.
Mm,
And that is really, this burnout issue that we keep talking about. It is sort of, on an incremental
yeah.
trajectory, and if not addressed, then really, AI, of course, is the right solution for that, where it allows them to really focus on and do the thing they love to do while taking care of all of the sort of the non-intellectual work or part of their work that is there. And really, one of the objectives with the things we're working on clearly is to sort of reignite that passion,
Yeah.
in the coming generation for healthcare, where they know that if they go there, that it's not going to be, things that they don't like, but they would have thoroughly the opportunity to really treat patients and be engaged with them while AI taking care of the rest.
The reason they signed up to be a physician in the first place,
Absolutely.
right?
Yeah.
Nurses and doctors is because I care. I want to help people get well, right? It's not necessarily I'm going to get rich unless you're going to plastic surgery. It is because it's not, the highest paying job. There's plenty more out. There's probably more 19-year-olds out there in some sort of tech
Yeah,
that are making more money. So there's the
that's
passion
correct.
behind it and wanting to help people. And if you haven't got the time to really help people, to really get to the root, also, as you said, the waiting list, like you you have something that's an emergency right now. Well, if you go to emergency, they are so inundated, especially here in Canada, because there's around 4 million people without doctors. I got one last year in December, and that was the first doctor I'd had in 7 years, right? So it's really, really difficult. And then they've got the tele doctor, but even trying to get an appointment with them, and there again, they're only just addressing which finger hurts, and that's
Yeah.
that. And it's like medicine and in the way of actually caring for a patient has become backseat.
Yeah.
And we need to put it back in the driver's seat. We need to put it back in. I want to help people, but I want all the machinery, the apparatus, everything that is going to assist me to pay attention to the patient and what the patient needs. And I think that an awful lot of this waiting list that we have, a lot of it is the fact we don't have enough um, physicians and people that do the x-rays and all of that, the support thing. We don't have enough of that. um, where are we investing our money in healthcare? I don't know, but if it's not going to the right place, and why in Canada do we not have enough doctors? And that a lot of it is to do with the paperwork, and especially in the West, of the cost of actually running the clinic, um, which they're trying to kind of sort out and entice more. But if we want good physicians, we need to give them the right tools. Let them, for the passion that they came into it with, let's
Yeah.
assist them keep that passion alive by giving them all the tools that they need so they can concentrate on the patient and the patient's needs.
That's absolutely true. I mean, there's two things that you really refer to. One is the efficiency
Yeah.
part, and the second is sort of the fragmented access to data or patient's information. Like you go to a person and they really sort of, have to put a band-aid on because they have to just focus on that one problem that you're there with because
Yes.
they have very little access to all the information that they
Mhm.
need at that point of care. And that is, both of these things are so important. Just to give you an example of the US healthcare system, like just based on the 2023 data, the total healthcare spending is roughly close to $4.5 trillion, out of which out of which a third of it is actually wasteful spending
Yes.
due to inefficiency and fragmented data access. I mean, a
Mm-hmm.
third of that. That is an
That's
enormous cost to think about. And that is really one place where AI can play
mm,
such an important role. It can, with improving interoperability with AI, where, the systems where, for example, if you went to a clinic or a hospital, or you're in, for example, Toronto, or you're in British Columbia, or in the US, whether you're on the East Coast or West Coast, it doesn't really matter. If with the right, sort of smart tools, we're able to
yeah.
collect that information that is available to
Mm-hmm.
the physician at the point of contact with the patient, the decision making can be so much more powerful. There's about 12 million misdiagnoses in
Oh, yeah.
US alone. And the reason, in a year, and the reason for that really is this fragmented
Mm-hmm.
access to information. The second thing is, just like we talked about, efficiency and wait times. Again, AI is really instrumental in that domain, where what it can do is just like take care of the time consuming part, where the physician can truly focus on the care of the patient, while that documentation and that non-intellectual part of work is already taken care of. And I think this companionship between AI and physician can really enable the human touch in healthcare, at the same time improve efficiency, decrease wasteful spending, and the healthcare could be so much better than we witness it right now.
I think, one of the major things that we have to look at, and, this is I have family in the UK, and, you're talking about that fragmented information. I mean, some of them are still sending out either emails or mail to doctors. And, my brother had a heart attack, and he had prostate and kidney problems, and none of those doctors were talking to each other. There was no cohesive information. And having one central thing that all, and whatever happens to you goes into one hub, and no matter where you are, it's accessible to a doctor that doesn't know anything about you, but now they know your history, right? And
Yeah.
that how many people do die from wrong medicines or wrongful operations because that information is not there.
Yeah, so just to give you an example about this interoperability front. For example, like presently in US, let's say I have a patient who comes into the hospital or to my clinic, for example, that I have to see. I have to request the record, and the way it's done is like I have to have the patient sign a request, and I fax it to the
Mm,
facility where I need the information from. And then usually it's a couple of weeks for them to respond to that. And
mhm,
then they send me like this hundreds of pages of information faxed back to me that I have to sift through to try to find out whatever useful
mhm.
information I need. And this is, imagine like an ER physician where he's seeing a patient the first time, sort of in
Yes.
a with a life-threatening emergency,
And who
and
can't
they
even
don't
talk
know
to them and tell them anything,
exactly, and
right?
they don't know anything about
Mm,
this patient. How incredibly powerful it
yes.
will be if that ER physician had at that point access to all of their healthcare information. And really, when we talk about Medway specifically, there's two specific domains in this access to data that we focus on. That well, number one, that it's in a timely manner, that there's
Mm,
no wastage of weeks and
mm,
days or even hours, that it's instantly delivered at that point of contact. And the second part, that it's useful information. It's
mm.
not like if I'm looking for somebody's CT scan, I don't want to go through 80 pages of information to try to find that. I don't have the
Right.
time to do that, and no ER physicians or any physician for that matter have that
Mm.
time. So really, with Medway, what we're trying to do is that you're able to, one, instantly get access to the information, and two, more importantly, that it is exactly what you're looking for. It's not just pages of information, it is exactly what your question is about.
So, in other words, they could address that AI information. What information do you have on, say, heart? with this person, and it can go through all the details. This person had a heart attack or murmur this, that, etc., and tell you. Is that how it works?
So it's a little more complicated process, and the U.S. government had established a system called, or an institution I would say called TAFCA, that's Trusted Exchange Framework and Common Agreement.
Hmm.
Basically, what it does is it is a framework where all the entities in the U.S. hypothetically can exchange patients' health information. And at the same time, it's extremely regulated because you get,
Have to be, yeah.
access to the most precious kind of information out there. So you need to be, sure to be compliant with all of those regulations. But in theory, what it's supposed to do is that it's a two-way flow of information. So, for example, if I get a patient, I will have the ability to search that patient's information within the system.
Mm.
And right now, as things are, first, of course, it is still going to be a while for that to have all of those, institutions and clinics and hospitals and everything connected to that. So
Right.
it's still a work in progress.
And each
But
state
I,
will have its own resistance and own rules and own
exactly.
bureaucracy. Yes. Yeah.
Yes,
Get out
and
of the
and
way.
and even when we have that, but I think the good thing is that we're getting to that point
Mm.
where it is being increasingly realized that it's not necessarily an option, that it's actually an obligation at this point, that we need to move in that direction. And I think
Yes.
that realization is the first and fundamental thing that needed to happen. But I think like the little I would say important aspect that we are adding to that is just the timeliness and the usefulness of that information.
Yeah.
Again, like you're able to query the system to bring you the information, the specific information that you're
Yeah.
looking for. Yes.
And you know, quite honestly, it's when Google came up, how many people, hey Google, da 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 da. So basically, what you're doing is taking information and honing it in a private manner. So people are, oh yeah, but once AI's got it, it's going to share it out with the rest of the world. No, because there are measures in place. Right?
Exactly.
There are firewalls in place, and this can only be used by physicians. It's not going to be, your local hacker down the road. It's this is the thing about it. It's just as protected, I assume, as banking is.
Perhaps more, I would say.
Hmm.
That is one important message I think everybody needs to hear about. That, healthcare information is probably the most protected and regulated, entity out there. So any such framework that is being built or worked on, it has to comply with all of that standards. That includes HIPAA compliance, of course, that ensures absolutely that that information is dealt with in a very safe and regulated way. At the same time, there are other things like SOC 2, there's ISO 27001. I mean, there's so many layers, and the healthcare information, it's when it's exchanged, it actually happens through specific APIs. So it's not even just like you can connect with Google to get information or anything.
Hmm.
Like there is actually a specific framework, like Fire
Hmm.
APIs is what we call them, in place to deal with that information, to retrieve and exchange that information in the most secure way possible.
So the only people that would have that would either be the physicians or the physicians administration in getting that information. So obviously they
That
have
is
to put in a code, whatever.
That is correct, absolutely. So, firstly, and like I said, this is a process that is
Mm.
evolving, and the final shape of it, we will see how it turns out to be. But the overall thought process is yes, that healthcare institutions. So, for example, if I am in a hospital and you come in as a patient to that hospital, that I'm able to, with your permission, gain access to your information. Sometimes
What if the
that
person is out of it and can't give you
Yeah,
that
yeah, yeah.
permission,
I
right?
was coming to that exactly. So sometimes that permission is somewhat I would say implied. Like, for
Mm.
example, if somebody's brought to the hospital, well, yes, they need to be taken care of,
Right,
if they're not
exactly.
able to speak or
Yeah,
interact or do anything. So you do whatever is necessary to give them the best care possible. And that really kind of applies to this situation as well. In this case, yes, you will access that information. But I think the simple thing is that the important aspect of it is that not everybody can just query that
yeah.
system or get access to that data, number one. The other part of this, which of course is going to be a growing trend over time, is as a patient, for example, I will have access to all of my information, and that is
Hmm.
also very powerful. Like right now you're relying on your system, like one healthcare system or another, having bits and pieces of your information. But as a patient, if, for example, on your phone or just some gadget, you have access to all of your information and you go to a physician and you can give them all of that picture at that point of care, I mean, that, of course, opens up so many doors for better ways of healthcare, of course.
We know that one of the biggest problems in medical is not treating the whole, just treating the parts. And, this is kind of where it's been forced to be. I know that I've interviewed a few doctors and they've said they've left the profession because they started treating their patients holistically. And they were told, unless you're pushing procedure or pushing drugs, we're going to blacklist you. And they were blacklisted for that. And I think this is criminal for a start. A physician, makes an oath to put the patient first, and it's become the other way. And doctors need to push back on this. And having that, I wish to look at a patient as a whole, and having all the information I can have there so I can really assess what it is. And if it isn't treatment, if it is something that is holistic out there and it will make the patient better, then that is my obligation. This is what I signed up to do. So there needs to be a lot of pushback, I think, with the farmer and accountants, as I call them, because this is, yes, you need to make money because you've got to pay the physicians and the hospitals and the da 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 da. Da. We understand that, but profit over people, no, it's people, people first, right? And so this needs to change. So I think that I can see this in assisting the physician, assisting the whole system in being able to treat the patient better, will actually allow the doctors to push back against this other thing. You must, and go, no, I won't, because I've got more energy and time now to spend on my patient because I'm not spending it all on the paperwork and fighting that system. So,
Yeah, I mean that's very right. The key thing there is, and this is a part of the oath that every physician
hmm
takes when they
hmm
become a physician, and perhaps the most important objective of anybody in healthcare is to deliver the best care to the patient, and that it's absolutely important that part of it is staying sacred and not
mm.
infected by the desire for money or some push from any entity whatsoever that is. And if anything in any way, shape, or form is being felt, I think as a physician, obviously that's my absolute responsibility to push back,
Yeah.
to confront that, to make sure that no other thing is involved in my decision making except the best interest of the patient. So I can see how important that is. Now, having said that, again, this role of AI sort of on that front, where you have the entire picture in front of
Mm.
you,
hmm
I think it makes you well equipped to make the right decision
Yeah.
and resist anything that is unnecessary, unwanted, and that is driven by anything else other than patient's best
To
interest.
defend your choice of treatment,
Absolutely.
right?
Absolutely. Yes.
I've got the whole picture here because of X, Y, and Z. This is the best treatment for the patient, right? This is
That's
what
exactly.
being a physician is. And I feel that if they're less exhausted and they're more come together, we know, as we are seeing evidence of, that when people come together en masse without the pitchforks, but with the arm in arm on the what I call the common sense love, coming from the heart, we're using common sense and fight back. But right now it just doctors feel almost under attack one by one. And look, you're in America right now, and politically with what's going on, everything being shut down, education, this, that, etc. How do you feel that? I mean, we've already seen the medical has been under attack. Um, how do you feel this is going right now with the AI? Do you think it's going to be embraced, or are they going to get threatened by it? Are we going to see Musk trying to infiltrate? I mean, because these are very viable concerns. We know that he's trying to, build a Starlink that's going to take over. So, a lot of people are looking at that and going, he's doing this to kind of try and take over and control. And then you're talking about AI medicine, where it's gathering your information, and then people put the two together rather than understanding the ethics of the separation. So how do you speak to that right now?
So I guess firstly, I want to stay out of the politics part of
I
it,
know, but
but
unfortunately, it's very much in there in the sense that
I
it is a
know, I know, but
disruptor.
I know, but what I would focus on is that, with the shrinking resources that are
Mm,
available, whether that is to healthcare or education or anything else, it is even more imperative now that we resort to things that
mm,
can reduce wasteful spending, that
yeah.
can increase efficiency, that can use the available resources in the best possible way. And I think in that context, I don't see AI used in the right context and in
Mm.
the right hands is going to feel threatened. In fact, it could actually gain more traction considering this is that alternative solution that gives you a solution to the problem at the same time consuming the least amount of resources, staying efficient, and staying on point.
We see medical offices where you look at the staff, and if you talk to them individually, everybody's fried because there's so much to do. And of course, a great deal of thing is data entry, right? Which is, who wants to do that? And, mistakes can be made from it. So you're saying that with this AI, as the doctor is treating a patient, is that being recorded? Is that then being assessed? And then, you know, um, you know, uh, um, summarized into what the patient needs, and then that goes into the record? How does it work?
So there's multiple things. Firstly, I'll tell you what's the prevalent practice, or I think the most common use case that's available in the industry out there, and that is what you refer to is what we call the AI scribe. What it
Mhm.
does is while the physician is talking to the patient, it records, that conversation, creates a transcript of it, and that results in a complete note, a note that then becomes part of the records of the patient. Now, before this AI scribe, this was something that had to be done. Like I could sit in front of a computer and type, or sometimes even, like sort of dictate, but I
Yeah.
think it saves all of that time. But the way, and I would say this is kind of how Medway is essentially different than some of the other solutions, is that we have a more holistic approach to the problem. So while that documentation is an essential bit that needs to be optimized, automated to give physician more time and efficiency, there is a number of other touch points between physician and technology. Just to kind of give you an example, like if you come to the clinic, before I even come to see you, I have to sit in front of the computer to try to dig through the information to try to find out, what is there, what has been going on, when were you
Mm.
last seen, and, who else have you seen, and so forth. There's that entire record in the electronic health records. And with that, what we're trying to do is we have implemented a conversational interface where a physician can just ask specifically, and that information is delivered both in text and voice format back. So it's really having kind of a super intelligent assistant that you
Yeah.
ask, and it digs through that information, gives you the answer instantly, saving you a lot of time. That is one thing. Then the AI scribe is the second part that we're doing. So while that encounter is happening, the focus is mainly on the patient rather than
Mm.
typing and dictating and doing other things. And then after you are done, there's a lot of a very other critical aspect to a physician workflow, and that is quality and what we call value-based care. Basically, the way the quality of that encountered or the quality of care as a physician I provide is measured in a very specific way. And sometimes that specific way means, certain number of clicks in certain specific areas in the EHR. That is, sometimes unfortunately are, very frustrating and time consuming. And that's the third part that we're trying to optimize and automate as much of that as possible. So again, really, the bigger picture is to relieve physician from these administrative burdens
Yeah.
to the maximum possible, ability. And really, the key thing again there is that you optimize all touch points of physician with technology, not just focus on scribe, not just focus on one thing, but have a more holistic approach. And the second bit that we talked about is that we optimize the fragmented access to information, that we improve that so that data is available at the same time. So empowered physicians who are relieved of the administrative
Mm.
burdens, who have the right information at their fingertips, are going to make far better decisions and are going to provide
Yeah.
a much better care.
What about multiple languages? Do you have translation? Because you may get a person that doesn't speak very much English and doesn't know quite how to describe it in English. So is AI then able to kind of translate as they're speaking so the
It
physician
does.
understand?
Yeah, it does. It's very interesting. I had a patient that I was talking to. We started off in English and then we switched to a different language altogether. And it was an interesting encounter because I wanted to see, what, like when it generates the note, what
Mm,
happens there. And it was perfect. I mean, to my
mm,
surprise, it was perfect. So firstly, yes, the tool that we create, and I'm sure there's multiple tools out there. It's because of the abilities of the underlying technology that is being used,
yes.
technology that it has multilingual support, and yes, you can in so many languages benefit from it.
So when you started this, is this because you yourself felt I am just bogged down with paperwork and hardly ever see my patients? Is that how you were feeling?
Absolutely. I started more on the hospital side, heavy on the
Mm,
hospital side. This was back in like, after my training 2013 and around that time. And every single day I noted sort of an incremental demand on my time, taking that time away from patient care, focusing more on documentation and compliance and legal stuff and so forth. And through these years, really, every single time I've looked to see if there is going to be a solution where it takes care of that problem. And it was really that personal kind of journey and suffering through
mm,
this process that led to, you see firsthand that like I, as a physician, am burning out and getting frustrated
yeah.
because of what I have to do. Uh, on the other hand, I see the patients are suffering because of all
Mm,
of this, and then we have a entirely inefficient system, whether that's a clinic or whether that's a hospital, and that was really kind of the insight that sparked the vision for Medway, thinking that there has to be a better way,
yeah.
for physician, a better way for patients, and a better way for healthcare institutions. And that is kind of how the vision for Medway came in, to restore that human connection, to create systems that more efficient, and to have a more relieved, physicians with sort of reignited passion for what they love to do.
I imagine that sometimes a doctor sees a patient and it's heavy. Maybe they have to tell them, not so long to live, or you've got to, let go of somebody. And it can be really traumatizing, obviously, for the patient and the family, but it's got to be traumatizing for the doctor. And, where have they got the time between patients just to take a moment for themselves to breathe? Now I've got to go and do the goddamn paperwork, and then I've got to go see somebody else. Where do I breathe? And
Mm,
if the paperwork is done, I'm going to take 10 minutes here just to feel what I need to feel because I'm human. Before I go in
yeah.
and robotically see someone else, I've got to address how I feel about the situation. Otherwise, it just gets suppressed, 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 and then comes out in all sorts of other ways.
Very true. I was actually looking at a picture on social media. This was an ER physician, I think after an unfortunate incident where, he had a patient in the ER, and a young person apparently who passed away. And this physician was overwhelmed and he stepped outside the ER and he sort of, on outside the ER, somebody took that picture where he's very emotional about that
Hmm.
situation. And just like you said, if your ER is flooded, if your clinic or hospital is flooded with patients, with you having very limited time, as a human, how do you, deal with those emotions where you are overwhelmed with sadness, in the one room, and then you have to go and tell somebody good news in the other room.
Mm, yeah,
You have to have, as a human, some time for yourself to sort of come out of that one
yeah.
situation and enter into that next. And yes, I think among all of those, the important thing is efficiency. The important thing is that you need to have time freed up from all of this non-intellectual work where you can be the human, where you can be the healer for your patients.
We know that COVID, I spoke to a doctor during COVID, and she said there's going to be so many people leaving the industry purely from burnout, purely from, like, she herself had signed more death certificates in 2 or 3 months than she had in her entire career. And, you had patient after patient coming in. I mean, God, did you need their information right there to know your time constraint? If you've got a busload of people that have had an accident and they're coming in, you need that information, right? You're not just treating the limb or the this, the that, it's what else is there. This information to have access to straight away automatically can save so much time in saving a life. Because you may have somebody that's allergic to this, or have a pacemaker, or have this or that, and you don't know initially, and so that it's life saving. And when you're at a crunch, when you're in a crisis, for the patient, but for the doctor, you're giving the tools to them to be life saving. You're giving them the information how to treat the patient. As you said, how many million a year? Either misdiagnosis or,
Well, yeah.
if we had all that information, that next diagnosis would go right down, preferably to zero. But mistakes do happen. But how do you treat somebody that's in a crisis, that can't talk to you, that it's literally life saving, like seconds count, and you don't have the right information there?
That's true. I think operating under normal circumstances is one thing, and
Mm,
under crises where we saw with COVID,
yeah,
the entire system, I mean, globally overburdened,
yeah,
where nobody could really know exactly how to deal with the problem. And this is not just one thing. I think we need to learn from those experiences and
yes.
be ready for anything down the line there again. And
Mm,
efficiency and the right use of resources, and freeing up physician and provider time, I think, are all part of that necessary preparation for anything that we might see in the future. Again, the second part that you alluded to was the access to information, having that entire information where your ER is flooded with so
mm,
many people in tragic situations. You need to have the right information at your fingertips to make swift decisions but make right decisions at the same time to save lives. Yes.
I think even when you go into a hospital, into a merge, and you go through the administrative, information, and then you're in the waiting room, if in that administrative thing they can pull up the medical and this person's claiming of this pain and they've got a history of this, you're not going to have them sit in the emergency for hours. Right.
Yeah.
So it is okay. This, how they do the tag an emergency. There's a red one, get it straight in there straight away. And that, will save lives because this person is prone to. And so therefore they need to be seen straight away. And it makes it the assessment of, what the emergency is so much better. And what we're
Yeah.
seeing so much today of is how many people are having anxiety attacks. And I think we're going to see a great deal more of them because of this
Mm.
unrest and shaking up that's going on in the world. And a lot of people, it's mimicking heart attack or it's causing other problems. And you can't have, well, I've only got 5 minutes for you to have this attack and tell me what's wrong. And it needs more time to talk down. If you've got the history there, and that everything else. So we're addressing the anxiety. We know how to hone in on this instead of like, could it be this? Could it be that? Could it be this? And you have more time to actually address it. There are so many pros. There isn't any
Mm.
con along the way. It
Yeah.
just allows you to be the doctor that you signed up to be and the patient to get the care that they need to have.
Absolutely. I'll give you a quick example. I had, was taking care of a patient. This was during my training. We actually admitted that patient came in with a possible infection type picture. And then this person had kidney failure at the same time, and their blood counts were bad, and they had fever, and they were confused, and there was so much going on. And we all sort of focused on, okay, well, this is an overwhelming infection and what we call
Mm,
sepsis, and treated for that. And really, on the third or fourth day, we realized there's another condition called TTP that could cause, a number of
mm,
those things with fever and confusion and kidney damage and so forth. So, and the treatment for that condition is entirely different
mhm,
than just that what we were doing. And of course, we had to transfer that patient to another facility for whatever was needed and so forth. But you know, if you have some sort of, what you're talking about is what we call a clinical decision support
mm,
system, where the AI can give you some useful insights by integrating that data to tell you, well, yes, you're right. Maybe you're focusing on ABC, but how about also think about XYZ?
mm,
I think, especially in an ER situation or in a critical care situation, those insights could be
mm.
saving and instrumental, really, the difference between life and death for that patient.
Yeah, I mean, we're looking at a medical system that, and also, I'm very much of a person that when I do go to a doctor, I know what I do need medically. I have a condition that really can't really be treated so much by medicine, but more holistically. And having a doctor that respects that I do know my body. I'm going for ABC. I need help on this, but I do know my body and I know what I need to support it. Instead of a doctor, I've literally been threatened by doctors. If you take this herbal, if you take this, I'm not going to treat you anymore. And it's like my sister goes for that and she won't take anything herbal at all because the doctors have threatened her. It's all drugs. And it's like, Gestapo. And I think kind of that it can weed out bad doctors because the data is there. And if they choose to go and see another doctor, the data is why are you being treated with this when this could do that for you? And I think, there are some doctors that are in it for the wrong reason. And or maybe in bed with pharmaceutical and want to push the drugs because they get a quota, who knows? It's there, they're there. And I think this is a way of holding them accountable because the data is there. Why are you treating this person with this drug when this is the problem? Right. So
Yeah, I think firstly, I would say as a physician, I would think my role is more of an advisor rather than a strictly speaking, making decision for people, but really, just communicating the right information, communicating evidence-based information, and letting the patient decide. Number one. The
yes.
second thing is we also need to be more respectful of their culture, religious
Yes.
beliefs, and,
Yes.
and so much more that really emphasizes care. Because really, at the end of the day, there's not a single way of doing it.
Mm-hmm.
The way I treat a patient patient in US may be entirely different than somebody doing it in India or China or South America or anywhere else for that matter. And so there's more than one ways of doing things. We have to be acknowledging and respectful of that. Our job as physicians is really to communicate, the most evidence-based information that is, data driven to help patient make the right call for themselves. And again, in that context, AI's ability to give you access to that
Yeah.
information, makes you incredibly empowered in that sense.
You have people with dementia, you have people with Alzheimer's, you have people with um, autism. And if you know that ahead of time, then you know that you're going to have to be addressing this patient in a different way with patience for a start,
Very,
right?
yeah, very true. And I think that is very, very important because if I don't have any context
Mhm.
in the situation that I'm entering into, of course, I'm going to say things or do things that may be irrelevant, inappropriate, and may lead to more friction than, the
Yeah.
patient believing you as their helper and healer. And if I have the right context
Mm.
available, that process can go way more smoother and better.
So many times you've got a patient saying, but the doctor's just not listening to me. They just keep putting me on this and that. No, they keep addressing this problem, but I feel it's that problem. And again, where the AI can come in is that, this is the information. Have you, doctor, looked at this problem? Whereas the doctor may not think, but I'm treating this. And it's like, as an assistant, it's an extra brain to help
Yeah.
you look at something that you could completely be missing. I don't know if you've seen this TV show Watson.
I
It's
have done, yeah,
it's so
okay. Mhm.
it's Sherlock Holmes and Watson, and Watson's running this clinic, but he runs it like as a detective, and
Okay,
so it's how to look at things and what could be the problem, where the evidence is not black and white,
very
and
obvious.
it's the investigation into it. Well, where they're doing it with a whole load of heads that have got PhDs and this, that, etc. We're looking at AI being able to do that for you, is saying, have you looked at this? Have you looked at that? And that is kind of the assistant that we're kind of looking at here. It takes your data, but it can assess indications could be that this could be the problem.
Yeah, I mean, we're looking at into a time where a lot of the times patients know about their problems
Mm,
than we know as physicians. They've
yes,
done their research because
yes.
they're very focused on that one problem. For me, I have to, as a physician, know everything or
Mm,
at least something about so many problems.
yes.
But for a patient, they have to know everything about that one problem. And
Mm-hmm,
when they come in, they're very well educated.
mm-hmm,
And again, I think in that context, I can definitely see, how technologies like these can be empowering and helpful dealing with situations like that. And of course, just like you said, giving you the perspective and the insights to
mm-hmm.
think outside of what you believe is going on, just to have a, kind of a more holistic approach to things, to have an all-encompassing view and considering everything in the right context. So yes, of course, in that context, I can definitely see a role for this technology to play.
And this isn't Dr. Google. How many people go to Dr. Google? They go to, oh, I've got flesh eating disease. I've got this, I've got that,
Yeah.
and it's like that same thing could be across so many avenues of
Yeah.
problems, right? But so this isn't the same as that. The data that you're giving this, I mean, AI learns from itself, doesn't it? So it accumulates that knowledge and is able to fill in the gaps that you aren't able to see because medical AI is a different information, different packaging that's going on there.
So it's a very thorough training process
Mm-hmm.
for the underlying model. Like if I can give you a simple example, let's say if an AI model is supposed to read an X-ray, I mean, before it's ever able to do that, there's probably hundreds of thousands of X-rays that
Yes.
are being read by specialists. They're provided to the model, telling it what the diagnosis was, what the abnormality is, where the normal is, and then sort of training that model is what we call that label data, and then providing it even more information and more information, and then eventually letting it sort of decide, and not even decide, I would say, but at least give some
Assess.
insights on,
Mhm.
assess, based on that information that it has, to see what it thinks about another X-ray that is not being read by somebody. And then, it gives you those insights, and then, a specialist comes by and they take a look at it. It just saves them a lot of time because some of that work is already done for them.
Mhm.
Now, of course, the area that we're focused on is entirely different. We're more
Mhm.
focused on physicians' workflows and
Mhm.
access to data. It's not necessarily radiology or anything
You're
else.
right.
But I think AI overall has so much potential in so many
Yes.
different domains. And even earlier, in the discussion, you talked about scheduling, for example.
Yes.
It can do so much in that, in terms of triage that you
Mhm.
mentioned, like who needs attention now and who could
Mhm.
probably wait. And, so there's so many things in healthcare specifically where all of that is applicable. Importantly, though, I think everybody needs to understand that for any technology to be used in healthcare, it is strictly regulated, it is
Mm.
vetted, it goes through a very stringent, training process. And on top of that, it is being monitored by physicians, and people who should be making the final call. So I think we need to have a little more trust in technology and
Mm.
have a little more adaptive approach, a friendly approach to the prospect and the potential it has to offer. And if we have that right approach, our systems can become way more efficient, and we may be able to restore that human connection in the healthcare that we are needing.
I don't know the terminology. I'm sure I'm going to say it wrong, but many hands make light work, but many heads bring better information. So basically, what you're looking at in AI is millions of heads that have come together with information, kind of in one big brain. And what that AI is doing is it's just got accessibility, accessibility to all of that information and can bring it forth to you at speed of light, in a way
Mm.
that, you can't call George and John and this and that one's dead. So how can you call him, So it's having all that wisdom and knowledge, in one act. This when computers came about, there used to be a city block, right? And then these big, huge things. And now you can have a
Yeah.
computer in your watch.
Mm.
Technology has gone so far and there's so much further to go. And I look at it actually allowing us to rise up into a higher elevation of humanity by being assistants in the mundane or being more accurate information. So we haven't got all the what I call the static information getting in the way, where we can really get to the point of things. AI is here to stay. Now, a lot of people, yeah, but it's used this way and it's used that way. In the wrong hands, it'll have the wrong use. In the right hands, it will have the right use. There's still that human element in there. And that's something we've got to remember. So anybody can misuse something if that's their intention. But when the
Uh,
intention is to enable
mhm.
and to enhance humanity, and then there's no stopping it. There's so far it can go.
That is very true. And that is essentially true for technology in general. Like,
Yes,
look at the internet, for
yes,
example. Look at everything, all of these social media platforms that we have. People can use it to do something more productive
yeah,
and transformative, and people can use it to, spread pain and fear
yeah,
and horror and all of those
yes.
things. So, yes, I think AI, of course, has the potential in both directions. The
Mm,
important thing is in terms of use in healthcare,
hmm.
any technology that is being developed or implemented in the healthcare system goes through a very strict regulatory process, compliance process, where it is assessed and reassessed and reassessed to make sure, that it's doing what it's supposed to be doing. So I think in this domain, the use of AI, of course, is very well regulated, and those regulations are going to evolve and adapt over time and
Yes.
improve further. But I think that in itself should have us have more faith in the technology and the use of it in the healthcare because the potential is immense. It's
Immense.
yeah, yeah, and it's just having the right approach to it is important.
So basically, what is happening is the brains are assessing the knowledge that goes into the data So all those, millions of brains are already doing that, so that you, at a touch of a hand or at an inquiry, can access that information like that. So, how, it's absolutely impossible to get hold of anybody and say, well, what do you think of this? What do you think of that? But the AI has got that information there because it is the accumulation of the brains that are in there.
That's very true. I mean, because you are training the model with an
Yeah.
enormous amount of data, enormous amount of information that comes into it. And, it makes that model incredibly powerful in terms of integrated all of that information, giving you an answer that is considerate of all of those. Um, Having said that, again, the final level of, I would say check and balance lies with physicians.
Yes.
The way the AI delivers performance is it basically gives insights, it gives decision support to the physician. At least in the foreseeable future, the way I see this is going to be an enabler and an empowerer of the physician rather than a replacement. So I think
Yes.
that companionship can make a great difference for healthcare in the years to come.
I went to get new glasses, and I went to a place called Specsavers, and hadn't done this way before. And my eyes were tested on so many different machines. And then I went into a room and talked to a virtual optometrist. And so she had all the information, more information than normally they would have, and then could assess what I needed. Right. And I think this is, perhaps a way we're going to see some doctors that go that way. And we do see it with the Taylor thing right now, but I think they need more information. But we're always going to need the doctor that can hold the hand, right? That, or they can look into the eyes and can actually physically touch you to find out what's wrong. We're always
Yeah.
going to have that. But there is also that place that, I need new prescriptions. Oh, well, let's look at your last set of prescriptions. These aren't working. Let's try this, that. That type of thing can be done over Zoom or phone or anything. But the efficiency of the AI helping you as to what has happened, what isn't working, what is that, can make that particular appointment go very quickly, leaving you time for the person that you do need to physically see and physically touch to find out what is wrong. So again, it assesses, what you need with the patient. I don't need to see you, just need to check on you. Or no, I really want you to come in because we really got to assess what the situation is. And you can do that from the data that has been accumulated, that is right there in front of you.
Yeah, I mean, we're talking about different use cases, in so many ways in
Mm,
healthcare. There's so much potential for it to play a role,
mm,
to enable the physician to provide the best care, to make the system more efficient, to make patient feel heard again, and all of those things, just like in optometry, you
mm,
mentioned, or we talked about radiology, and we talked
mm.
about any clinical workflow in general. There's so much potential and so much role for AI to play to optimize things to make them more efficient. Absolutely.
Do you only deal with kind of like the family physician right now? Are you working with hospitals? Do you work with psychiatrists or psychologists, physiotherapists? How broad is the spectrum at the present moment?
This is a technology that can potentially be used by anybody
Mm,
in the healthcare delivery system. So any kind of physicians can. Now, of course, over time, the technology will refine and get better to be best suited for every single
mm,
person's use case. For example, as an internal medicine physician, the role I have to play is somewhat nuanced and different than a specialist that they play, or each specialist again is then different in their own very unique way. And so this technology over time is going to evolve for each particular use case. But in theory, it is a technology that is available to everybody, that everybody can benefit from. So when we offer it, it is basically offered to all physicians of any specialty that they can benefit from this. And like I said, over time, we're going to focus on like right now, for example, and this is going to be the key thing in any development in this domain,
Yeah.
really relies on the domain expertise and the feedback from your
Mm,
users. You know, your focus on the users, the most critical thing in this. And let's say, you know, there's 100 cardiologists, they use it and they give us a certain feedback, we need to tweak it for their use case.
mhm,
And then there's a kidney specialist and maybe 100 or 1,000 of them use it and they give us some
mhm.
consistent feedback that that is the challenge that they're having it with. And this is how all solutions in healthcare are
Yes.
going to evolve, and ours is not an exception. But the bottom line is, yes, it's available to and should help all physicians of all
Right.
kinds.
So you know the thing about it is you've got the building boxes, you've got the foundation there, and then you know the specialization and the other building blocks will come as the information is needed or provided, and it'll just expand on itself. And the thing with AI, there is no limit. It can take on the world, you know, and of information, and then kind of refine it down to what you need to know when you need to know it. And so it almost even learns on itself, doesn't it? You know, these doctors are the input has been this, and the deduction is that. So we're looking at a sleuth. We're looking at an assistant. We're looking at, you know, appointment maker. We're looking at database. All of these type of things, all in one place, which makes life so much easier for the doctor. So they can come to work with a smile. I'm actually
Yeah,
going to see some patients today and really help them, and I'm not going to be bogged down
yeah,
by all the paperwork or trying to guess what's happened or what did we do last time. You know,
yeah.
I mean, let's face it, who can read a doctor's handwriting anyway, right? So I don't think even the doctor can sometimes.
That's true. You know, I will tell you an interesting thing, and I don't know how true that is, but I heard back in the day, you know, doctors used to have pretty good handwriting. But what happened is the nurses would actually look at their documentation and find mistakes there.
Yeah.
So they decided to write in a way where nobody could read what they wrote.
Well, there lies a problem right there, right? So that's
So I
another
don't
reason
know
why
how
we need
true that is,
AI.
but I mean,
I mean, every doctor I've ever had, you know, it's like, read what, you know, but yes, I think, you know, it covers up kind of, well, it doesn't cover up, it addresses little mistakes. Right? You
yeah,
know, maybe
yeah,
a doctor when he's typing and he's tired and he's putting input into data and, you know, mistakes are going to be made. Well, if you're dictating it and it's transcripting and then summarizing, you know, it's taking the word and I'm sure it can inquire, do you mean this? Right? So,
yeah,
you know,
yeah. There's so many layers in
yeah,
place to make sure that the information is correct at the
mm,
same time that it's traceable,
yeah,
like, you know, to the discussion that was had, not necessarily that it just hallucinates and creates something of its own, but it's directly
yeah,
relatable and traceable to the source. So yes, that's all there. And yes, you're very right. You know, decreases the chances of error,
yeah.
you know, make system more consistent, you know, and efficient. Yes, absolutely.
You know, we all get kind of paranoid about our medical thing, and it's you know, if I look at my medical history, I wouldn't even know where it is now. You know, when I lost one doctor because he retired and I didn't have another, a company took it, and I can only go to another doctor. So I gave them the link to it, and I don't even know if they haven't managed to access it because you know they wanted money for it. So, you know, who knows? Having something that you know, especially if you're taking a child that can have this medical history all the way through their life, right? And how many things happen later in life that actually kind of stemmed from that something happened in childhood. Never would think to look back there, but
Yeah.
you know the data is there, and the AI can assess. You know, because it can look back more, you know, clearly than we can, and so this, and it can, as you said, as it improves and becomes more and more intelligent, then more and more it can deduce. So I think that, you know,
Yeah.
it's a great way to go.
I think the one thing AI is really good at is retrieval of information. So if
Mm,
you give it a stack of papers and ask a question, it can give you a pretty accurate answer in very little time. And that is one limitation as a human we have is just like you
mm,
mentioned, if somebody has loads and loads of information, their health history right from when they were born up until they're 70 years old, that is not possible for a human being to look at and
no,
and make decisions based on at least not spending days of time on
yeah.
that information.
I'm being
But
scared
for
to
an
death as you go through it.
yeah. But AI can make that
Yeah,
much more efficient and
yeah,
make that data much more productive in that sense. Yes.
right. So that you know really what you are treating rather than looking at when you were 10 this and when you were 20 that. Yeah, it's deduction again. It's that sleuth again. Can work
Yeah.
things out for us that way faster than our little brains can,
Yeah.
because it can have all this information. If we took what AI had and tried to put it in our own brain, would probably explode, right? So what we're looking
Yeah.
at is just the very, very big brain that we have access to it, which is fantastic. And I talk about it all the time in business and even just in moral support. I've had many a conversation with my chat GBT. And as I said, the interview I did with it was mind blowing. The conversation
Mm.
that we had was sometimes better than the people I've interviewed. So, and it learns from our conversations and refers back to conversations that we've had. And no, it doesn't give out my information anywhere else. This is our platform. And when you're looking at your medical information, it's your platform that's accessible by a legal practitioner, right? So it's your information. And I think
Mm.
that's good to have that information gathered there so that if you are in a crisis, you can't speak for yourself, then somebody can assess it and not chop off your arm because your fingers are crushed and you're a musician. There's
Yeah.
so many things that we hear bizarre things happening
Mm.
in that 12 million you were talking about of misdiagnosis and everything else. Let's
Yeah.
bring that number right down by actually empowering the doctors to know, what the history is so they can better treat the patient in the now.
Yeah, I mean, these use cases that we keep talking about are going to evolve into much, much more over time. As we see an evolving role for AI in every little
Yeah.
thing that we do. I mean, in a given day, I have an almost 4-year-old son, and he interacts with AI on an almost regular basis. Just asking like, "Tell me a joke" or "Tell me a
Mm.
story," and I mean, it's incredible to see a 4-year-old interacting with AI like that and finding some value and meaning
Yes.
there. I'm sure there's a lot of potential for all of us to find something useful
And
there
of
too.
course, with the AI, there's no judgment, right?
There is
There's a lot of empathy, but there's no judgment.
that is very
And,
true.
that is something that's really great in teaching. I mean, you do have an awful lot of people that are under stress or maybe depression or this or that, and they don't want to talk to somebody because the fear of the judgment or snap out of it, all of that type of stuff. And you talk to chat and they will give you suggestions. Have you tried this, that, etc., or just support. And sometimes all you need
It,
is someone to talk to.
Yeah, it doesn't get tired, it doesn't get
Nope,
frustrated.
nope,
It will empathize to you
yes.
to however lengths you want to go it with. So yeah, you're right. I mean, it's really amazing how technology can have such profound value in so many different situations, that we deal with on a regular basis.
I always say humans are the problem, but we're also the solution. We can be utterly brilliant, great, and incredible creatures, or we could be the worst of the worst. And that comes down to human choice.
That
And so,
is true.
what we feed will grow. And so, if we choose to feed the goodness of what AI can bring to us, how it enables us as human beings to evolve to a higher level, higher plane, then I'm all for it in any way. And there will always be the people that will misuse it. Those are people that have issues with themselves and they use it as a weapon to make themselves feel better by causing harm to other people. There will always be those type of people unless they're willing to do the work on themselves. And we all have to take onus and responsibility for ourselves. So everything is about choice. And if we can assist the doctors, the nurses, whatever practitioner you're going to, with having all the information of you, and we don't get frustrated because they're not listening to us, what they've seen your history, right? And now they're going to hear what your complaint is, and they have a better understanding of how to treat you. Let us assist them in assisting us.
That is very true. I think that really summarizes it really well because, if they are more empowered with technology where they have time to listen to you and they have all the information they need to make, to guide you and make that decision, that could incredibly be, like transformative in healthcare and really what is the absolute need in healthcare right now because every situation that we're looking at is either affected by inefficiency, either affected
Mm,
by loss of access to information, or nobody has time to do anything. And if
right.
we make that system efficient and free up people's time and make them more engaging and empathetic, that is the way to go.
Absolutely. So you obviously are addressing this to doctors, practitioners, practitioners, nurses, anybody in the medical field right now. What is the process that they have to go through in order to sign up for this with Medway?
So I would say they go to our website, and that is medway.ai, MED Medway .ai, and they can over there just with a single click, send a request for demo. And the way it works is, one of the people from our team connects with them to find the right time that works for everybody. Demo the product so that they can touch and feel and know about the product as to what it does, how it does it. And that's one important area that we focus on and want to spend some time on to make sure, for the best value you can get from a product is if you know how to deal with
Yeah.
it, if you know how to operate it. And so we want to make sure that experience is seamless and important and done in a more productive way. So when that happens, it's more of a subscription model where they sign up for a monthly subscription for the product use. It is available sort of as a standalone product, but it's also integrated with some of the major electronic healthcare record systems like Epic or Cerner, Athena Health, Advanced MD. There's so many more that it's integrated with, and we're continuing to work on more integrations to make it the most value for everybody, regardless of what electronic health record system they're using.
And you've been doing this a while, and obviously there's so many more doctors to gather. And this is not just in the States, this is elsewhere as well.
Yes, it could be practically anywhere in the world.
Well, excellent.
As a standalone product, they can benefit from it anywhere. If they want it integrated with the EHR, it depends on, whether we are integrated with that EHR, which most of them we have already, sort of the ones that are uh, used in most countries, whether that's Canada, US, Europe, and even the Middle East, and a lot of other countries, we are integrated with the major ones so they can benefit from it. Absolutely.
Excellent. So there aren't any borders there, right? Which
No.
is really good to know because people do travel. Um, so they have that, and then of course it's the as you said, it's the use of it. And for some people, they're not. Oh, I'm in medicine. I'm not in tech. I don't know how to use it. So you show them the process of literally connecting the dots type of thing and
It
how to
is,
use it.
it is, it is very easy, seamless, and intuitive. I think it's as simple as I'll give you an example, like asking a question to retrieve the data is just simply asking a
Mm,
question. Like you go to the platform and you can either type to chat or you can just click on the mic and just ask the question, and that information is delivered. So it's as easy as that. With regards to the scribe for recording data, it's really just before you start the encounter, you just say, create encounter and start, and it just, by the time you're done with it, you just stop recording and it generates a note. So it's not really, any tech heavy in any sense. And of course, I'm a physician, and I wouldn't call myself like a tech genius by any means. So I need a product that, first and foremost is able to solve my problem as a physician and by extension, everybody else. And really, when we make that design and user experience, this is one of the key areas that we focus on, that it's very simple and easy to use. And that's why we focus on, making healthcare simpler,
Yeah.
smarter, and compassionate. That kind of goes
And what
along.
if people have a past history in written form or some, zip thing? How do they add that if they want to? I've got a patient, I've got all the history, I now want to put it under one file, so that I can add to it with the AI. So can you integrate that information?
It can, yes, because that's how so when they add this add-on, I would call it,
Hmm.
to their electronic healthcare record system, it interacts with it in real time and bringing that information in a more usable way from, the electronic health record system. Yes.
So
So it
you can add any past information into the current.
absolutely, yes,
Excellent.
yes, that can be
Can you
done. Yeah.
imagine how easy it is for a doctor's office to take, everything they have, which is all digital nowadays, right? Paper was done away with a long time ago. Take
Yeah.
all that digital information, put it into that patient's AI file, and now everything's under one umbrella. So,
Yeah,
I mean,
and I want to, sometimes we feel like the AI is kind of something different, like
mhm,
a separate entity altogether. It's
right?
not. It is
No.
just our way of interacting with that information that exists there already. So it doesn't necessarily make something new or does something new. It basically makes that information much more usable, presentable in a timely manner for us to make the right judgments from it, is what it really does. So this AI layer is basically just an add-in to your electronic health record system where you query it or you do whatever you need to have access to that information there in a more efficient way.
And efficiency is where it's at. As you said, let's reduce the time. Let's increase the time with the patient. Let's reduce the time and all the paperwork and the information. Let's give the physician the information they need so they know how to treat the patient and not second guessing because you don't know what they've had before. Let's the patient use AI on, I need more information on the patient based on the information from the past. So it becomes an assistant, right? And then as you said, for the actual patient, if they want access to their medical for some reason, they've got it, they're empowered. Because I know that when I tried to get information from my doctor, it was cloak and dagger, right?
Yeah.
And in this way, it's like it's easily sent to you by email, and there you are. Right. Please
Yeah.
safeguard it, though. That's up to you to safeguard it when it
Yeah.
comes to you, right?
That's
You
right.
can't blame anybody else. It's just you. But it does give empowerment to the patient, empowerment to the physician, empowerment to the medical system. And let's reduce those costs. Let's give the doctors more time with patients. Let's be more efficient so we bring that number down of misdiagnosis. All right. And let's use it as a tool as it is meant to be, and then really kind of reduce patient care in a lot of sense, because ideally you want a patient to be so well they don't need to see you, because there's always somebody that does, right? I actually
Yeah,
had a doctor
absolutely.
say that to me when I was talking about nutritionals. Yeah, but if you take those you won't need to see me anymore. And it's like there's always patients for you to see, so don't be so threatened, right? There's
Yeah.
always something, but
That's
ultimately what
true.
you want is to see your patient well. So
Absolutely. And I think you can focus on prevention there.
yes,
Prevention's
yes,
better than care anyway. So,
absolutely.
and it enables you in so many ways to do that as well. Absolutely.
Yeah. So it's a win-win all the way along the line.
Yeah.
A simple sign in to any obviously they've got to have their medical ID in order to do that. Otherwise, Joe can't do it. It has to be some medical practice there. Do you assess the people that are signing into it of, that there isn't malpractice or anything else? Do you screen the people?
So, any person who gains access, obviously, they have to belong to a healthcare system or institution, whether it's a small or large clinic or it's a hospital system. So, yes, I mean, it's not, firstly, it's not like going out to anybody, number one. But the
Right.
more important thing is when you gain access to it, the tool by itself is nothing without access to the data. The
Mm,
data is only approachable if I, as a physician, have access to the patient's data.
right.
Otherwise, that tool for me is useless. So let's say if any XYZ get access to the tool, they cannot do anything with it because the access to information is not there. That is an additional layer, or I should say there may be multiple layers of
Mm,
security and safety through there where you are, legally in the position to access that information. And there's so much layers embedded in that process. So not anybody can access that information without having that clearance for that.
good. And that's what it's need. We want to feel secure. We want to feel supported. You want to be supported in supporting us, right?
Sure.
And you want to know the data is there. I mean, look at it. As I said, for a patient going into ER, immediately know they're high risk of heart disease or this or that, right? They're having chest pain. We're not going to sit them in ER for the next 6, 7, 8 hours, right? They need to
Yeah.
be seen straight away. So
Right.
it just makes everything so much more efficient. And when you can empower the human to be better at patient care, everybody wins because we see so much
Mm.
burnout and so many people leave the medical profession because they don't feel supported. They do have the burnout. And oh, if only I had this, I could have saved that patient, right? So let's give them all the knowledge that they can have in order to be able to do what they need to do.
Very true. I mean, it takes care of the inefficiency, it empowers the physician, and it empowers the patient at the same time. Like the overall system and everybody involved benefits from it. Yes.
No losers here whatsoever. And I imagine a great deal of good breath release from doctors are going, oh, I don't have to do that anymore. So,
Yeah.
so benefits all along the way. And I always say that the people that come up with the most creative things are the people that are in the position. They're looking for something to help them in whatever they're facing. And they come up with something that they need that then serves everybody else, which is exactly what's happened with you. So thank you for taking that path and not just going, I wish I had, but instead of
Mm.
saying, I'm going to create, because that's what we need. So the site again is Medway, MEDWAY.ai. You can get hold of him at email zshah@medway.ai, and he's also on LinkedIn under his name, Zaman Shah 449, and you can touch bases with him there. But if you are a physician, if you're in any form of practice and you want to be able to have this kind of tool that's going to help you serve your people better, then this is the way to do it, right? So it's start, look, you're not going to know how it's going to fit or how it's going to assess you, help you, unless you get in there and do a little proactiveness of looking at what it is and seeing how it can help you. And ultimately, it helps you, it will help your patients. And that's the bottom line.
That is very true. And thank you for sharing that information. I think the objective here is that most people benefit from it and that they are able to be the best version of themselves and taking care of their patients to improve healthcare overall for everybody. That's the mission and that's the vision we are working towards.
And whether you are a medical person listening to this podcast or a patient, go into your doctor and say, have you heard of Medway? I have you heard of it? Because this could help you. And listen to this podcast or reach out to their site, right? Because don't feel as a patient you've got to wait for the doctor to find it. Maybe the doctor's too busy to find it, doesn't know about it. Go and tell them. Go and tell them.
That is true. I mean, I've come across so many amazing tools that have made my life so much easier
Mm,
in different ways, and they come from friends, and they come from my
mm.
patients, and they can come from anybody. And I think if we are able to spread the word in whatever way or capacity we can, making more people benefit from the technology, that is great. We all need to pitch in to do that.
We do. We're in this life together. So let's be of assistance to each other and sharing knowledge. Like AI sharing knowledge, let us give AI knowledge, but also let's give each other knowledge. Because if we can
Mm.
assist each other to be the best that we can be, then we all benefit from it as a whole society. So thank you,
Mhm.
Zaman, for sharing today. I love this redirect that you've got and the need that you saw with that, and that you're not afraid of AI. You see the wonderful benefits from it. And yeah, there's so many boxes that it ticks that, that really benefit everybody on all scales. And kind of what I feel summarize of it is it's kind of one of those assistant type things that gives everybody a good deep breath. I feel I can breathe now,
Yeah.
right? So and that's what we need. It's like, oh, now I've got to do this, now I've got to do that. Every immediately breath starts, now it's already done. I don't
Yeah.
have to do it.
That's true. I mean, it was very empowering. And thank you so much for the opportunity and this incredible discussion. I really appreciate it.
I appreciate you too. So remember, folks, medway.ai. Look at it. Whether you are a physician or not, go and look at it. Take it along to your doctor, your practitioner, nurse, whoever, your therapist, or whoever it is, because this is something that can assist them that ultimately will assist you. So until next time, folks, bye for now. We hope that you enjoyed the show. There are so many more for you here on selfdiscoverywisdom.com. Just go to the podcast tag at the top there and you will see all the many genres and all 3,000 shows ready for your listening. We are here to serve you, to help you on your journey of life, and we know that through inspiration it begets invitation. We are supported by you, the listeners, and those that we interview. Anything that you can spare us in donation would be greatly accepted, and we do hope that you enjoy the next show.